Since 2006, May 17th is World Hypertension Day. This year, to mark the occasion, the Heart and Stroke Foundation, in collaboration with the University of the West Indies, Cave Hill campus, held a high blood pressure screening event at the State House today. Deputy Dean of the Faculty of Medical Science, Cave Hill campus, Dr. Kenneth Connell, gave a detailed breakdown of high blood pressure and its causes, as well as discussing the impact COVID-19 has had on high blood pressure treatment in Barbados.
High blood pressure is defined as an elevation in blood pressure such that it puts a patient's internal organs at risk. Traditionally, this has been chosen based on population data. In other words, what blood pressure within the population do you see people starting to get risk factors such as heart attacks and strokes, and also kidney disease resulting in dialysis. This blood pressure seems to occur roughly at 140 on 90, but a normal blood pressure is really defined as less than 120 on 80. So there's an area between 120 on 80 to 140 on 90. Some authorities call this range pre-hypertension, which is really a flag to healthcare providers and patients that patients who might have this be in this range should aggressively address risk factors. High blood pressure causes the lives of many people internationally. It's the number one cause of death in women. In low to middle income countries such as the Caribbean and in particularly Barbados, the disease burden is significant with control rates just over 20%. The causes are largely placed in two buckets. One are what we call essential hypertension, where no secondary cause is known, and then there are the secondary causes where something could be wrong with, for instance, a person's glands, like their thyroid gland, for instance. They may have a secretion of hormones from another gland called the adrenal gland that might cause hypertension. But largely, more than 90, and in some books, 95% of cases are caused by essential hypertension. This is when, like many Black Caribbean people, your gene for hypertension gets turned on. It's inherited at birth and it's with you in your genetic code. At around the age of in your mid-20s or sometimes in your early 40s, this gene is switched on. And until another Nobel Prize winner comes along to figure out how to get it switched off, it's very difficult to treat this type of hypertension with just lifestyle changes. So I like to describe COVID as the burning platform. And those of you who are familiar with business would recognize that term. Burning platforms allow institutions and businesses to create real change and to kind of build back better. The COVID pandemic has nakedly exposed the weaknesses within our own health system. For instance, access to care, as personnel had to be shifted from the Queen Elizabeth Hospital to Harrison Point, as private doctors' offices had to be closed, as people had to rationalize their medication because they just did not want to go near anywhere where other people were gathering. And so what this showed is that there were certain barriers to continued control of hypertension. For instance, there was no pharmacy delivery service. There was no telemonitoring or telemedicine available for patients living with high blood pressure. And also, the treatment regimens that were used were quite complex. So it was very difficult to say to someone over the telephone, double the tablet, because there were so many tablets they were taking, right? What COVID has also done, as most of our society knows, it has placed the person living with non-communicable diseases like hypertension at a much higher risk for severe outcomes. What most people don't know, however, is that even after recovery from COVID-19, which in the Omicron surge could very well be asymptomatic, people living with hypertension or high blood pressure are also at an increased risk for long COVID syndrome, or the post-acute sequelae of SARS-CoV-2. What this means is that they're more at risk for things like heart failure, for inflammation of the heart, for inflammation of the lungs, and although they may have had a very mild course, they're now at risk for a very long course of adverse outcomes and morbidity. And this is what we're trying to prevent. This is why it's so important to control your blood pressure pre-COVID, but more importantly, if you have been infected, to make sure that you are controlling your blood pressure even post-COVID.
Registered dietitian Victoria Cox spoke about ways one could manage their high blood pressure through what they eat.
There are a lot of things that you can do to manage hypertension or lower blood pressure through your diet. So the most common thing that tends to come to mind is moderating your salt or sodium intake, so basically trying to consume less salt, whether that is through adjusting how you're seasoning your food, so not using salt or bouillon cubes, liming your chicken and fish but not adding in the salt, minimizing processed meats, so like canned meats and cured meats and things like that, prioritizing home cooking as opposed to eating out. But the sodium is just one piece of the puzzle. There's a lot of foods we want to focus on increasing our intake of, so foods that are high in potassium, magnesium, calcium, all help to sort of relax blood vessels and lower blood pressure. And those would be generally foods like fruits and veggies, so dark leafy greens, things like sweet potato, bananas, nuts and seeds, so almonds and pumpkin seeds, avocado, legumes like lentils and black beans. So I like to think of it as a holistic thing of not just less salt or sodium, but more of these other nutritious foods as well that all really can be quite effective at lowering your blood pressure.